I'd like to thank Catherine Martirena, her local help and local IC group, and Jill Osborne for all of the effort that went into having this meeting. I think it was a lot of work. How many of you are from outside of San Diego County? How many people are coming from outside of California? So we have quite a few people that have traveled the distance at any rate. Well, I get a lot of questions about interstitial cystitis that run into sort of common themes, and I'm going to go over some of them, going over what you would like to know. And during that process, I'm going to interact with you because I found out that most of you are going to want to ask questions anyway, and we might as well ask questions along the way. I've been working with interstitial cystitis, you're right, it's a little updated, at least 25 years, and it's just something that sort of happened in my career. And I know one thing, everything that I've learned about interstitial cystitis, I've learned from the patient. All you have to do is listen to what you tell us, and we can start to figure out what's going on in terms of how the disease develops, what triggers it, what causes it, and more importantly, what you can do to treat it. And I think a lot of doctors that specialize, so-called doctors that specialize in IC, don't do that. And I have seen about 7,000 patients, and you've taught me a lot. 1980, we would say we don't know very much about this disease. And if anybody says that today, I just like to say, well, you better read the literature. You're about 25 years behind. 1980, for example, it was estimated there were about 20 to 30,000 people in the United States with interstitial cystitis. Today, it's more like 30 million people. What's changed? We started screening populations, fixed populations of females, with a symptom questionnaire of your symptoms, just asking a population that have it. There are a lot of data coming out in a large study screening 23,000 women in a birth control program of reproductive age. 1 out of 3.8 predict to have IC. It's that common. Probably 1 out of 12 men. Is the microphone fading or? Okay. And the first question that comes to mind was, well, how come we didn't know that it was that common in 1980? It was because we only recognized the severe form of the disease. The person lying in the floor in pain and suffering, that's clearly from the bladder. Well, they knew that that patient existed 200 years ago. The question that isn't well asked by many of the experts is, what was that 60-year-old woman like when she was 20? She had frequency. She had symptoms, did she not have the disease? And that's the problem. A lot of people haven't paid attention to how this disease progresses. And during the time that that 60-year-old with severe end-stage bladder, by the way, that's only 1 out of 500 people. By the time she was 20, she already had symptoms. And so what I would like to talk about is why people get symptoms. I'd like to talk about a little bit about the pathogenesis, or what makes the disease occur. We'll talk about some of the other issues about flaring. We'll talk about some of the issues. Probably more importantly, you're concerned more about the issues of treatment. In fact, more specifically, your treatment. At least that's what I would be. When I listened to that former speaker, I was thinking, what was my purpose? And I almost forgot what I was going to say. But at any rate, these are the issues that I would like to address. And I'd like to address the cause. Well, in order to address the cause, you sort of have to understand what the normal function of the bladder is. Bladder has 2 types of sensory fibers. Sensory fibers are those fibers, nerve fibers, that carry signals to your brain so that you know something's happening. Like in your skin, you have sensory fibers for pain, for heat, for cold, for touch, light touch, deep touch. Well, the bladder's not that sophisticated. It's only got 2 types of sensory fibers. It has the fiber for urgency. This is the fiber that tells you your bladder is full. Everybody has a fiber that's active 7/24. All normal bladders and mammals and animals know when their bladder is full. And that's the fiber that tells you when it's full. Now, that fiber is not supposed to be active until you have about 15, 16, or 17 ounces in your bladder, in that general range. I know most of you think that's an impossibility. No, that's what a normal bladder capacity is. And so that fiber activates normally at about 15 or 16 ounces. When this disease starts, the nerves get activated or upregulated, as we say. In that context, instead of being activated at 15 ounces, then when someone's 15 years old, it's 14, 13 ounces. They're 20 years old, it's 11 or 12 ounces. They're 30-year-old, it's down to 8 or 6 ounces. Well, 10 ounces is fine. You can live around that. That's not a problem. But when it gets down to be 2 or 3 ounces, that's a problem. At that point, that fiber is so active, even when you go to the bathroom, you still feel like you haven't emptied your bladder and you have to go. And it's lying to you. It's telling you your bladder is full when it's not. And that's what this disease is about. What activates that urge fiber? The other fiber that we all have in our bladders is the pain fiber. The pain fiber only activates, in fact, normal bladders, it probably doesn't activate over years. You never know it's there. You know it's there when you accidentally go past your volume. You can't get to a bathroom for whatever reason. And instead of 15, you've got 25 ounces in your bladder. With that much, you get pain. The normal bladder gets pain. Another time it may activate was with a bad bacterial cystitis will activate. And that's a true bacterial cystitis, which is rare. Most of you think you've had bladder infections. Now, maybe one, maybe two, but all those other flares were just your IC. But that's when a normal pain fiber will activate. Well, in this disease process, they start to activate. And the rule of thumb that I've noticed in the patients is that first you get the frequency. This is where you start going to the bathroom 10 times a day, 8 times a day. Normal, by the way, is 3 to 5 in 24 hours. I know that you can't appreciate that. In fact, I would bet most of you have never done that in your memory, because the frequency fiber was already activated when you were very young. And so it progressively upregulates with each decade of life. So as the disease progresses, the pain starts to activate. That's when you're likely to see a doctor. The frequency is really bad and the urgency is bad, you'll see a doctor, and that can happen overnight. It can happen in 3 hours. You go from okay to all these symptoms. And so then the pain fiber starts to activate. That brings you to see the doctor. And usually in the early phases, when someone's around 17 or 18, it'll happen in a few hours. You get intense urgency, frequency, pain, maybe some blood in your urine. Everybody thinks it's a bladder infection. 99.9% of the doctors in the United States think it is a bladder infection. We'll treat you for a bladder infection. But in fact, it's just a flare of this disease process. It's activation of the pain fiber. And then, as the disease wends its way over the years of your life, those bursts of pain start to come more often and last longer. What triggers them? Females, it's triggered by sex. 75% of you will have a flare usually associated with sex. It will either be during sex you'll have pain, or more likely when you're 20, it'll be a day or two later. I don't know why, it just occurs and flares a day or two later. And that's what everybody says, and I believe them.